What's the one key takeaway that you want everyone to remember from Power in a Pouch?
The reason why this Power in a Pouch report is so important, especially for health professionals, is that we know that of the 8 billion people on Earth, 1.4 billion people are still smoking. We also know that smoking-related diseases contribute to at least 62% of global premature mortality. So by far, this is the biggest issue in population health. As a physician, I'm extremely concerned about patients' individual health, and often that is overlooked. And I've been in so many consultations with patients where they've tried absolutely everything to stop smoking. And for me, that's the main takeaway of this report. There is hope for somebody who smokes, who has tried multiple times to stop smoking and who have not succeeded. And we know that at least 62% of all smokers really want to stop. So in this report, I think, is the answer. It's the key. And Swedish women who smoke especially have shown us that at first they were not happy to switch to traditional Swedish snus, which is a tobacco-based snus. But the moment when oral nicotine pouches came onto the market, this was the game changer in Sweden. Swedish women then decided, well, here is something which is discreet, which is culturally acceptable, and has helped, as we've shown in the report, has helped many Swedish females who smoke to quit smoking. And at the end of the day, that is what this is all about. We would like people who smoke to have the option and the access to the means to either quit completely, and if they cannot quit, to switch. Our biggest issue with the World Health Organization has been that in the Framework Convention on Tobacco Control, Article 1D, harm reduction methods are explicitly recognized, but completely ignored in practice. And this is costing lives, simply put. The Swedish example shows that, and this report validates this once again, that you have a country that has by far the best tobacco control practice on earth, and as a sub part of that plot, the Swedish females to me have shown us the way. They were not happy with switching just to vaping. They were not happy to switch to Swedish snus. They felt that with oral nicotine pouches, this was the easiest and most appropriate way for them to stop smoking. So by far the key takeaway of this report is oral nicotine pouches have helped female women especially to stop smoking through switching, and that this can be applied to all of the 194 member states of WHO. We must not remember that in public health, there are two key determinants for success. Number one is female education. Number two is per capita income. Here we've seen that with Swedish females, they act as the ambassadors for public health and individual health in their families. And they've shown the way in Sweden. And the reason why that's such a beautiful result in the survey is that for the second aspect of, or second key determinant of public health, and that's per capita income, for poor countries, this is obviously also a game changer because oral nicotine pouches are accessible, in most cases much more affordable than any other form of nicotine delivery systems, and it is also acceptable for those consumers in poor countries. I'll rephrase that last sentence. This report shows that oral nicotine pouches can be a game changer also for the poor countries. Public health shows that some of the key determinants for good public health is the level of female education and secondly, the per capita income. In short, poor countries do very badly in smoking, so you always have a high smoking rate in poor countries. And in countries where the female voice is not heard, not respected, we also find that smoking cessation is a problem. So this Swedish report shows that oral nicotine pouches, as used by Swedish females who smoke, have been a game changer in their lives. It's been a game changer in the population health of Swedish females. And it's also applicable to all the poor countries in the world. Lower and middle income countries should look at Sweden and look at oral nicotine pouches as their game changer.